So welcome you back again to this CSIR JIGYASA webinar series, Let's Talk Science, What, Why and How, being organized by CSIR in collaboration with INEAS. So today we are going to talk about a topic, cancer, that is a very prevalent disease in our country, and also we lost two legendary actors due to this particular disease. So today we have Dr. Aravind from IIT Hyderabad, who is going to talk about this particular topic. I take this opportunity to introduce Dr. Aravind, a physician scientist working at IIT Hyderabad, uh, having expertise in nano-bio interaction in life science research. He has extensive research and clinical experience. His work on photothermal therapy using biodegradable gold-based nanoparticles recognized at various levels. Currently, his lab is involved in using in vitro and in vivo platforms for therapeutics, nanoparticles uptake, therapeutics, photothermal therapy. He is also a recipient of various prestigious awards being given by various academies of India, including INSA, NASI, and INE. So with this brief introduction, I welcome Dr. Aravind for his talk, and students are waiting for him. Welcome.
Yeah. Thank you, Dr. Pooja. First of all, I'd like to thank Dr. Pooja for giving me an opportunity to interact with students and teachers. And I'd like to thank COVID-19 as well. It is because of which we are sitting in our home and then we are able to interact with each other. Having said that, when Dr. Pooja asked us to fill the forms for our interested topics, I was wondering in what way this cancer topic is going to be related. But as she mentioned, in the within the span of last lecture and the current lecture, you can see we have lost two important film personalities. One is Irfan Khan, who actually died of neuroendocrine tumor, and the other person, I am forgetting his name now. uh, uh, mm, he is Kapoor, right? Rishi Kapoor, right? Yeah. So he as well died of cancer, which is called as leukemia. So that explains us that cancer is actually a dreadful disease which is killing a lot of people, and it is one of the leading cause of death in this world. So let me briefly explain to you first, like what do we call as cancer and what is normal. Cancer cells are nothing but they are a part of our own cells which started to behave abnormally. So they start to divide abnormally, they start to invade other areas, and then they start to destroy normal cells. Now, cancer cells, though they are a part of our own body, how do they destroy other normal cells? In the sense, they take up all the nutrients that are available in our body to themselves for their enormous division, and as a result of which the normal cells do not get enough nutrition, as a result of which they start to die. And when you divide tumors, you can easily, I mean, you can simplified way, you can divide them into benign as well as malignant. And benign tumors are nothing but they do divide rapidly, but then they are very confined to that own place, which means that they are not going to spread to other area. And if we can remove those tumors, then mostly they will not recur. But malignant tumors is what we call as cancer, because they not only divide but they also spread to other areas. Yeah. And if we want to classify cancers, then we can classify them into broadly three types. One is something called as carcinomas, which arises from the organ tissues, membranes, and glands and ducts, and they usually spread to other neighboring sites, which we call as metastasis. And these important sites include head and neck, lung, prostate, breast, esophagus, colorectum, and anus. The other smaller variety are called as sarcomas. They are mainly formed from soft connective tissues like muscle and then from bone, and they are less common when compared with carcinomas, but they spread to distant site at a very early stage. And then finally, we also have blood cancers, which can be broadly classified into leukemia, which occurs in white blood cells, then lymphoma, which occurs in lymph nodes, and then myeloma, which occurs in the plasma cells of bone. Yeah. So when it comes to what are the common type of cancers, in men we have lung cancer and prostate cancer as the common type, whereas in women we have breast cancer and lung cancer. And when it comes to India, we have oral cancer, especially when it comes to men, and among women we have cervical cancer as the most commonest type. And what is the reason why we should pay attention to the most common type of cancers is that these two cancers, that is oral cancer and cervical cancer, which are the most common type of cancers in India, both these things are actually preventable. So it is important to have a proper knowledge about these cancers so that we can prevent them from happening. uh, yeah, so this oral cancer, the main reason is because of tobacco chewing, which is very rampant in India. And cervical cancer is mainly caused by human papilloma virus. And if a proper vaccination is taken up for human papilloma virus, then we can prevent cervical cancer. And if tobacco chewing and tobacco use is reduced, then obviously this will also prevent this oral cancer. Coming to the causes, the main fundamental cause for cancer is mutation. That is alteration that is happening in a gene. Gene is a segment of DNA. Now, what happens when this mutation occurs? Day in and day out, actually, we are having some kind of mutation happening in our body. But then there are a lot of protective mechanisms that are present in our cells which can repair these mutations and which can prevent these kind of abnormal growth. Now, at times, these errors that happens when these DNA replicates is missed, and that results actually in cancerous type of growth. And after that, once it gets mutated, then it starts to divide rapidly, and then it grows uncontrollably because there is no suppression. Usually, we have certain genes called as tumor suppressor genes. Their main role is to suppress the excessive growth. But at times, when these tumor suppressor genes get mutated, then they no longer are able to stop the uncontrollable cell growth, as a result of which cancer occurs. And again, the mistakes that need to be repaired gets damaged, as a result of which again cancer occurs. So it is because of these kind of mutations that happens in the cellular level that is responsible for cancer. Now, what causes these mutations? Now, the main cause is, of course, I said it is genetic, but then is it before somebody gets birth or after birth? Both. So, the one that happens at birth are called as hereditary genetic mutations, which are carried forward from our ancestors and from our parents. The one that occurs after birth, that is during our lifetime, is mainly due to environmental causes. And in today's world, because of highly polluted environment and the mixture of a lot of chemicals in our day-to-day activities, this kind of genetic mutation is increasing at a larger level. And we have classified, I mean, the scientific community have classified these kind of cancer causing chemicals as carcinogens. And also our lifestyle modification, we see a lot of people becoming obese, and then there are a lot of hormonal changes that are happening, and there are a lot of chronic inflammation that happens, and then there is also this lack of exercise, which again leads to obesity. All these are risk factors, and the most important risk factor is smoking. So all these things add to genetic mutation that happens after birth. So these are the main causes for the genes to get mutated. Coming to risk factors. So first is age. So certain cancers occurs in very younger age. You, Pooja.
Yeah, I mean,
Oh, sorry for the inconvenience. Hello.
yes, Aravind, yeah, start.
Yeah. Is the screen visible?
Yeah, it's visible. It's clearly
Okay,
visible.
okay, fine. So let me start back from where I had left. It is the environmental factors. So I was saying, like, because of the polluted environment that we live in, that also is responsible for cancer. So some of the environmental factors includes this asbestos and benzene and the chemicals, and already mentioned the what is it the type of the habits, that is smoking, and then obesity, etc. Yeah. Yeah. Coming to symptoms, depending upon the type of cancer, the symptoms vary. So I am just going to quote some of the major symptoms for each of the cancer types. So when it comes to breast cancer, we have this breast lump. So that is why they ask women to examine. Self-examination of breast is recommended for the reproductive age group, wherein if at all they have history of breast cancer running in their family, then they are expected to self-examine and then report if at all there is a kind of breast lump. And then there is this swelling in the axilla because of the enlargement of lymph nodes that is present in the axilla. Then discharge and bleeding from the nipple retraction, and any other symptoms that happens because of the spread of the cancer to the adjacent areas. Coming to head and neck cancer, mainly this related to oral and throat cancer, wherein we get chronic cough and then hoarseness of voice, and then there will be difficulty in swallowing, and there will be persistent mouth ulcers, and then there will be hemoptysis, which is a medical term for when the patient coughs out sputum, which is containing blood. Okay, so coughing out sputum with blood is called as hemoptysis. And then pain in the throat, and again any other symptom that is related to spread of the disease, spread of the cancer to other parts. And then when it comes to lung cancer, because lung is the organ that is involved for breathing, then you will get breathlessness, chest pain. Again, there will be chronic cough and hemoptysis, as I said, coughing out of blood-filled sputum. And then when it comes to brain tumors, the patient gets headache. Then because this is also related to hearing and then vision, the patient may suffer from speech problem, they may suffer from visual problems, and mostly the motor functions are compromised. That is, there will be weakness of limbs, and there will be difficulty in walking, and there will also be loss of coordination and loss of consciousness occasionally. Yeah. Then coming to symptoms of cancer related to gastrointestinal tract, there will be dyspepsia, which is just a medical term given for indigestion and heartburns, and there will be frequent vomiting, even blood vomiting will be there, which is called as hematemesis, and then black stools. It is like when there is blood discharge in the upper intestine, it gets mixed with the enzymes that are secreted in the intestine, and then becomes a black stool called as melena. And then there will also be fresh bleeding per rectum, and then there is a possibility of lump in the abdomen, and then there is also a possibility of fluid accumulating in the abdomen. So that clinical condition is called as ascites, wherein the stomach or the abdomen will be appearing swollen. And then there will be pain in the abdomen and also pain during defecation, and then there is a possibility of jaundice as well, that is yellowing discoloration because of a problem in the liver. And then when it comes to urinary tract cancers, often the main sign and symptom is passing of blood filled urine, which is called as hematuria. And there will be pain in the abdomen. Then there will be frequent urination, and also passing of urine at night frequently, that is called as nocturia. And then pain during passage of urine, that is called as dysuria. And then when it comes to gynecological cancers, there will be bleeding per vagina, which is called as bleeding PV. And then there will be vaginal discharge because of excess mucus secretions. and then there will be pain in the abdomen. So these are some of the common signs and symptoms which indicate, but it is not necessary that always these are going to indicate cancer. It depends upon the comorbid conditions that are there. The people do not need not worry the moment they get some pain in the abdomen or somewhere. Okay, it is always better to consult a physician and then get it checked if at all the patient or the person falls under the risk group of cancer. And when it comes to cancer metastasis, as I said earlier, the reason why cancer is dangerous is that it is not only going to divide in the localized area, it is also going to spread to the other area. And that is where the problem starts. Like once it spreads, then it is going to cause damage to those normal tissues which are there in those regions where it is spreading. For example, you can see in this picture, you have this lung cancer which is going to get metastasized to bone, which is going to get metastasized to brain. It is also going to get metastasized to the other lung, and then it is also capable of metastasizing to the glands like adrenal gland, which are located on the top of kidneys. It is the spread which is going to actually cause a lot of damage when it comes to cancer affected patients. And once the cancer has crossed the stage of localized division to metastasis, or once it has spread to other areas, then it is really difficult to control it. And depending upon the type of cancer, there is a pattern in which it gets to spread. So when it comes to bladder cancer, it usually spreads to bone, liver and lung. And when it comes to breast cancer, it again spreads to bone, brain, liver and lung. And similarly, you have when it comes to lung cancer, it spreads to, I already mentioned it, like adrenal gland, bone, brain, liver and other lung. And melanoma is a type of serious skin cancer which occurs mostly because of excessive exposure to UV rays, and that spreads to bone, brain, liver, skin, other parts of the skin, and then muscle. Okay, so then I'll just read about uterus. Again, uterine cancer again spreads to bone, liver, lung, peritoneum, and vagina. Okay, peritoneum is nothing but a layer of covering thing in the abdominal region. Yeah. So when it comes to cancer prevention, as I said, majority of the cancers that occur after birth are because of environmental risk factors. So if we can avoid smoking, if we can avoid consumption of tobacco products, then many cancers can get prevented. We should follow a disciplinary lifestyle like good exercise, and taking avoiding junk foods and all these things, and reduced consumption of meat, red meat and processed meat, and increased consumption of green and leafy vegetables. All these things actually can easily help us to prevent the most common cancers that I already mentioned. And then vaccination against cancers that are actually caused by virus is again another good way of preventing. For example, cervical cancer, because it is being caused by human papilloma virus, women are expected to take these vaccination at the appropriate time. And then hepatitis B virus actually can result in hepatitis, which is the inflammation of liver, and that chronic inflammation finally leads to liver cancer. So there is a good vaccination available for hepatitis B. So it not only prevents us from getting hepatitis, but also prevents from us from getting this is called as hepatoma or liver cancer. And coming to treatment, there are mainly three types of treatment that is available. The first is surgery, wherein a surgeon goes to the site of the tumor and then completely removes it. Okay. The second is radiotherapy, wherein X-rays and gamma rays are showered from outside the body to that area where the tumor is localized. And at times they also keep sensitizers within the body and then shower X-rays. So that is is radiosensitizer based X-ray therapy, or sometimes they can even keep the probe that has the ability to generate X-ray radiation inside the area. This is mainly done for cervical cancer tumors, wherein you can easily keep the probe inside the body in that localized area, and that is called as brachytherapy. And then the final thing is chemotherapy and targeted therapy, and also latest we have CAR T cell and immunotherapy, wherein we take drugs which act on the body, and each of these procedures have certain type of limitations. For example, when it comes to surgery, it is very much limited to the skill of the surgeon. A well skilled surgeon knows what is the stage of cancer, or where all to look at while treating the patient, and hopefully he will be removing all the affected areas. But at times there may be some areas which are left unremoved, and then that causes the reason for recurrence of the tumor. And when it comes to radiotherapy, again, it is a radical kind of treatment which not only kills normal cells but also healthy, not only kills cancer cells but also healthy normal cells. As a result of which, lot of side effects happen. And then when it comes to chemotherapy, the same thing happens. Like chemotherapy works on a simple rule that it kills all fast growing cells. So obviously cancer cells are fast growing, so definitely chemotherapy is going to affect cancer cells. But then in our body there are also many other normal cells, like lining of the mouth, like our hair cells, which are also fast growing cells. As a result of which, when somebody takes chemotherapy to treat cancer cells, these chemotherapeutic drugs not only affect the cancer cells, but they also start affecting those normal fast growing cells like hair cells. As a result of which, they lose their hair, and then the lining of the epithelial lining of the intestines and the mouth and other areas get affected. And that is the reason why people suffer from a lot of side effects when they are undergoing this cancer treatment. So that is where a new branch of science emerged, wherein people started looking at what are all the type of modalities by which we could improve the treatment that is given for this cancer. So one of the area is theranostics, wherein we combine therapeutics with diagnostics. So in a country like India, I'll go back to the slide. Actually, a patient goes to the hospital, gets diagnosed for cancer, and if at all he has to start either radiotherapy or chemotherapy or surgery, then there is a time period of wait involved, because majority of the Indian population either belong to the middle class or below poverty line. So the treatment has to be given free of cost, which can only happen under government setup, and there is a big queue involved in treating these cancer affected patients. As a result of which, there is a big gap that occurs between identification of the cancer patient and then subjecting them to treatment. So this gap between treatment, diagnosis and treatment is going to be very crucial, because during this gap the cancer can spread to other areas, and that almost becomes like untreatable kind of disease. So a new kind of area emerged which is called as theranostics, wherein we not only identify the tumor but also treat it then and there with the help of external influence. So one such kind of theranostic element is by using nanoparticles. And here what we do is we synthesize nanoparticles, we tune them to specific wavelength of light in the NIR region, and we choose this near infrared light. The reason being that will have certain depth of penetration, as a result of which we can treat at least slightly some deep seated tumors, if not too deep. And then once these particles will be tuned in such a way that they will go and they will deposit themselves in that area where cancer cells are present, and then light will be showered onto that area. And this is a very focused laser light, and the particles have been tuned in such a way that they will only they absorb this light, and this light will be converted to heat, and that heat will kill the cells. So this is called as photothermal therapy, wherein photons that are emanating from the light source get converted to thermal energy or heat source, and that heat is going to kill cells. Now these nanoparticles that are actually acting as transducers which converts light to heat can also emit fluorescence, can also emit x-ray signal. So as a result of which we can just inject these particles so that they will first help us to identify whether there is cancer cell or not. And once identification is done, then we can, through the external source, either light could be used or x-ray could be used, which will help in treating the cells at that point. So that is what we call as theranostics, because herein we are not only identifying the cancer cell but also treating it simultaneously. So the gap between, or the golden hour between diagnosis and treatment gets reduced. And we have synthesized different types of nanoparticles, and one of the area that we ventured into it was choosing a drug delivery system which is made up of lipid called as liposome, and then putting these nanoparticles inside this liposome and using it for drug delivery. And we found that we could use this kind of therapy for not only for identifying the tumor but also for treating it. But the problem is, once we treat these kind of tumors, then the nanoparticle that is given to the body has to get removed from the body completely. Now majority of these kind of photothermal agents have metallic elements, especially made up of gold. And gold, if at all it has to get excreted from the body completely, then the size has to be really really small. It has to be less than 5 nanometer. But then for photothermal therapy, as I said earlier, it has to have an absorbance in the near infrared region. Now gold, which is of size less than 5 nanometer, will not have absorbance in that region. So we have to make a kind of dual system wherein these liposomes are studded with gold particles in such a way that they at least have that size range which is conducive for NIR absorption. So that size range comes around 100 nanometer. And then during the process of photothermal therapy, wherein we hit it with laser light, then the heat is going to kill cells causing DNA damage. At the same time, this also disintegrates the surface assembled gold to smaller particles, which can get cleared via kidney. So that was our research area, wherein we synthesized nanoparticles and then we tuned them to specific wavelength of light in the NIR region. You can see these absorbance happening in the NIR region. And then we also checked if at all when it is treated with laser light, is it becoming small so that it can get completely clear from the body. Now the question is, why we want these particles to get cleared from the body? Why can't they stay in the body? The problem is these are particles which are not inherent systems in the body, and if at all they keep getting accumulated in the body, then they themselves will cause some other side effect in the long run. So that is the reason why whatever material that is foreign to the body that is used for treatment, they also should get removed completely from the body. And then we did some animal studies, and this is a typical example of how photothermal therapy works. So we have grown some cells in lab which are fluorescent cells. And then this, you see this control figure wherein we didn't give any treatment to it, they were just grown. And then here we have treated these cells with our particles. Again, these particles are perfectly non-toxic, nothing happens to the cells. And here we have treated them with only light, that is laser light. Again, this laser light is a very low power laser light, it doesn't harm the cells. Whereas here we have treated them with particles and also showered light onto them. Now the moment the particles come in contact with laser, as I said earlier, they absorb this light, convert them into heat, and that heat has killed only those areas where this laser light is showered. And because this laser light had a circular projection, only in those areas we have got cell death. As a result of which, you can use this kind of photothermal effect for a very localized treatment. And the advantage of this kind of therapy is that you can prevent the damage that is happening to the adjacent normal cells. So normal cells can be preserved, and only cancer cells can be made to die. And here is a video wherein we checked the ability of these particles to be used for diagnostics or to be used for imaging purpose. Normally, in clinics, we have iodoform. This is iodoform, which is a form of iodine, which is used as a radio contrast. But iodoform is used only for diagnostics. Whereas we have prepared this liposomal particle, which I showed earlier, is a very good photothermal agent which could be used for therapy. So our aim in this experiment was to check up whether this liposomal particle was giving signal equivalent to that of iodoform. So I'll play this video. You see, iodoform is giving very good signal, and liposomal is also able to give good signal equivalent to that of iodoform. This proved that this liposomal particle can not only used for photothermal therapy, that is for therapy of cancer, but can also be used for diagnostics or for identifying. So you just have to inject this particle, as a result of which it will go, based on either actively or passively targeting, it will go and reach the tumor site, and then it will exhibit signal when subjected to X-ray analysis. And once, if at all signal is received, it means that there is a possibility of cancer occurring in that area, and then you can treat them with either NAR light, or these gold particles are also good radio sensitizers, so they can also be used for X-ray radiation in a very localized manner. And because they are radio sensitizers, the dosage of radiation that is required also gets reduced. Yeah, so we found that when we inject only the control, this is a dye that is used as a control. The dye goes and then just comes out, but then this dye is not going to get accumulated in urinary bladder region. So this is the region where you expect the thing particles to get cleared, because after getting filtered by kidney, they are expected to come to urine via bladder. So, but when we have tagged this dye with our particles, within few hours we are able to see a good amount of accumulation happening in the bladder region, which showed that they are capable of getting cleared from the body completely. So these are other analysis where we took urine and we subjected to them to elemental analysis, and we found that the gold is actually getting excreted in good amount, which means that it is very safe to be used. And finally, we did some pilot studies wherein we took a control and the tumor kept growing. The more red it is like it is growing to a larger extent. Whereas when we treated them with particles and subjected to laser light, the tumor got completely ablated. And this is a post-treatment follow-up of that same animal, which showed there is no recurrence of the tumor coming, and even the blackish discoloration got disappeared after a few days. So this is another study wherein we found that if we are able to play with the type of nanosystem that we have, we are able to make the particles to reach the tumor site without any targeting element. Usually we use antibodies so that it goes and binds to the specific antigens that are present in the tumor site. And here we have not used any antibody. It works on a specialized mechanism called as enhanced permeation tension ability, but I'm not going to the details of it. I'll keep it simple. So you just have to inject these particles and they go to the tumor site and get accumulated there. So here we see that within few hours there is a good amount of accumulation of these particles happening in the tumor site. And this particle could very well be used for diagnostic purpose. You just have to inject this particle IV intravenously, and then if at all there is a tumor, it will begin to get accumulated there in that tumorigenic region. And then once the tumor is identified, because this particle is also photothermally active, you can then and there treat it using an air radiation. So we also tried loading these nanoparticles with drugs. Here we have used a phytopharmaceutical called curcumin, which is nothing but the turmeric that we use in our kitchen. And we found that when used along with photothermal therapy, it showed really good results without causing much of a recurrence of the tumor. And here you find this word adjuvant. Adjuvant is a kind of name given to a therapy that is added to the main therapy. Say, for example, if a person suffers from cancer, only one modality of treatment is not going to help him. He has to follow some other additional supplementary therapy which will help in complete cure, or which will help to prevent recurrence of the tumor. So when a person is subjected to surgery, then they may also ask the patient to undergo radiation after the surgery is over, to ensure that whatever remnant tumors that are left in that particular area also gets to die by radiation. So these supplementary therapies are called as adjuvant therapies. And at times, depending upon the size of the tumor, if the surgeon feels that the tumor size is so large and it is going to be a complicated surgery, what he does is that he asks the patient to either undergo chemotherapy or radiation therapy, so that it will help in shrinking of the tumor size, and then he operates the patient and gets the tumor removed. So in those cases where a supplementary therapy is given even before the start of the main therapy, it is called as a neoadjuvant therapy. Yeah, so we also developed some other nano formulations involving Indian medicinal plants. So here we have taken extracts from a plant called as Anthocephalus kadamba, and it fluoresces very nicely. You see the red fluorescence that is coming out of Anthocephalus kadamba, as a result of which we could use not only for photothermal therapy but also for specific medicinal properties of these plants, which are helpful in treating cancer cells. So with this, I'd like to conclude. I'd like to thank the collaborators and the funding agencies and my lab students. Yeah, this is a few photos of IIT Hyderabad for you. I'll be happy to take questions.
Yeah. Dr. Aravind, can you
Yeah.
switch on your, please? Yeah. You can stop sharing, then we can start with the questions.
Yes, yes, yes.
So there are a couple of questions I picked up from chat box. Your
Yes,
screen
yes.
is still shared. You have to stop.
Okay, okay.
Yeah, that's clear. So a couple of questions which I picked from the chat box.
Yes.
So what is the difference between carcinoma and leukemia? So this is a question asked by some students.
Okay. So, as I said earlier, both carcinoma and leukemia are cancers. Okay. Carcinoma arises from hard tissue, soft tissues, and or organ tissues, which means that it is a kind of solid tumor. Whereas leukemia are not solid tumors. Leukemias are cancers that arises from white blood cells. So the origin of leukemia is going to be bone marrow, and the cancer cells will be found in our blood. So that is a kind of non-solid tumor, whereas carcinoma are solid tumors.
Okay, so thank you for nicely explaining it. There is one question on the food habits, like eating raw rice or red meat could cause cancer.
Yes, yes. So red meat actually causes cancer. In fact, red meat is known to have a strong association with colon cancer. Now, if you can see in the earlier 1990, 80s, and 90s, the incidence of colon cancer in India was very, very less. Whereas in the incidence of colon cancer in the West was very high. The reason being they were having a lot of red meat consumption when compared with us. In India, there was not a big rise in red meat consumption during those days. And if you take up countries like UK, they have made it mandatory for people who are above the age of 45 to mandatorily undergo colonoscopy procedure to check up whether there is a possibility of colon cancer or not. The reason being, colon cancer is very highly prevalent in those countries, whereas in India it was not prevalent to that extent in the past. But currently there is a big rise that is happening in colon cancer purely due to the increase in the consumption of red meat. So now the advice is to reduce the consumption of red meat. And the reason why they say is that red meat, most of the times it irritates the lining of the colon, and constant irritation and inflammation actually results in cancer.
So what about rice? Like eating raw rice also causes known for causing cancer?
Raw rice, I'm not very sure. But then it is always advisable to take well cooked and well boiled food. Anything that is taken in raw form is going to have different types of antigens that may not be conducive to our body, and these kind of antigens are actually going to cause inflammation, and that ultimately may lead to cancer.
So another question is about the chemotherapy. Like chemotherapy has several side effects. Why is it
Yeah,
like hair fall and other side effects?
yeah,
Why
yeah.
is it so?
Yeah. So, like I said in my talk, chemotherapy works on a single principle. That is, it is going to kill all fast growing cells. Uh, Cancer cells obviously are fast growing cells. So, chemotherapy will definitely kill cancer cells. On the contrary, not all normal cells are slow growing cells. There are also normal cells which are fast growing cells, and chemotherapy or chemotherapeutic drug will not be able to differentiate between a normal fast growing cell and a cancerous fast growing cell. Unfortunately, that not only kills these cancer cells but also kills those fast growing cells which are these hair cells and the lining of epitheliums and other things, as a result of which we have this side effect. So the thing is, like, it is not able to differentiate between normal fast growing and abnormally fast growing.
Okay. Thank you, Aravind. There is another question. Is there any relation between diabetes and cancer?
Yeah, there are multiple fold of difference. One is like, usually diabetes goes hand in hand with obesity. The reason being, it is obesity that is going to cause type 2 diabetes because of poor receptors. Okay, the receptors, insulin receptors fail when there is excess fat in the body, and here diabetes in the long run is going to cause reduction of immunity. The immune system of the body is going to be compromised if the patient is going to be diabetic for a long time. And here the important role is that, as I said earlier, mutations do happen in our body day in and day out, but there are good immune cells called as cytotoxic T cells, which identify these kind of abnormal cells and kill it then and there. But when it comes to diabetes, because of diabetes leading on to reduction of immunity, that is also going to impinge on the effect of these cytotoxic T cells, which could be the reason why there is a positive correlation between diabetes and cancer.
Okay. Thank you for clearly explaining it. There's one question on is it possible to control cancer at third and fourth stage using any treatment?
Unfortunately, no. When I didn't explain much about the stages. So usually cancer is divided based on this tumor nodes and metastasis TNM classification into four type of stages: stage 1, stage 2, stage 3, and stage 4. And among these, stage 3 and stage 4, usually it only means that it has spread to lymph nodes and it has spread to other areas of the body. And once it spreads to other areas of the body, identifying those areas and treating them is highly impossible, and only palliative care could be given for these terminal stages. So palliative care, what I mean is, like, it is not a treatment given for curing the patient, but it is a treatment given for reducing the suffering of the patient.
Okay. So there is one myth also, like sometimes wants to get it clarified. Like, can cancer spread from one to another?
No, cancer is not infectious. So all these, what is it? What you call as systemic diseases like diabetes, cancer, they are all classified under non-communicable diseases. So cancer will not spread from one person to another person. Cancer is not infectious.
Okay. And how the cancer it spreads from one part of the body, like if it is there in one part of the body, how it spreads to the blood?
Yeah, usually it spreads via a specialized channel called as lymphatic channel. So you will see a pattern. Of course, it can also get into blood, and then it can through glow through blood vessels to areas, remote areas. It only depends upon what is the adjacent site, and not everything is clearly understood about the way how it metastasizes and when it metastasizes, because if that is understood, then people can actually prevent this spread from happening. And by preventing spread, it only means that we are going to change the way how a tumor behaves from malignant to non-malignant, that is benign. So that is a really challenging thing. We have not understood very clearly about what are all the reasons for metastasis. There could be the same type of tumor which behaves without metastasis in one person, and it may not. It goes for rapid metastasis in another person. So there are multiple factors, and there is a lot of research that is ongoing in this area. But
Yeah.
generally, it spreads through lymphatic channels.
Okay. So we are coming to the last couple of questions. You talked about nanoparticles
Yeah.
for the treatment. So in a very simple language, can you explain it to the students who are from like 8th to 12th class, because they couldn't understand this? What are nanoparticles? Yeah.
Okay, so nanoparticles are very small, tiny structures which we cannot see with our naked eye. So to keep it simple, what I tell you is like you have a bowl of halwa given to you, and if people ask you to eat it, you are not going to take the halwa as one go and then going to swallow it, because it will not be absorbed. You take bits and pieces. You take small amount of thing and then you put it into your mouth, and then you taste it and you enjoy it, right? The reason here is you are taking very small amount from that big amount. So when drugs or anything, any element is given in bulk quantity or in bigger quantity, it is very hard for it to interact. Whereas when it is given in very small quantity, it is very easy for it to interact. So that is why we switch to very small systems called as nanosystems, which will have better interaction. The other example that I could think about is if you put sugar in your tea or coffee, the time it takes for dissolving is going to be high if at all these are crystals. But if you powder the sugar and if you add it in your tea or coffee, it will dissolve very fast. The reason being you are making that micro crystals or that bigger crystals into very small crystals. As a result of which, the interaction is going to be very high.
Yeah, thank you for nicely explaining it with examples.
Yeah.
There, one question is like, what kind of food is required for cancer patients? It should be a protein-rich food or a carbohydrate-rich food.
That depends. It depends upon what type of cancer is there. Say, for example, if somebody is suffering from renal cancer, then the body will find it really hard to filtrate protein-rich foods. Generally, a bland kind of diet is advised, and it should not have spices. And other than that, they can take up any normal bland diet. There is no specialized diet for cancer, and protein rich food is always good. But then we'll have to be cautious when it comes to the type of cancer. Say, for example, if the cancer involves these filtering mechanisms, then it is not good to load it with high protein substances which they find it very difficult to filter out.
Okay. And how frequently one should go for a checkup? Like, so is it like one should go for routine checkup for this problem?
That depends upon to which kind of category the patient belongs to. Say, for example, if a person has no history of cancer in their previous generation, then there is no much of need to worry. But that is one thing. And if a person has their what is it uncle or auntie or their bloodline suffering from cancer, then they should at least go for once in a yearly checkup or once in 6 months checkup for that cancer. This is very particular, in particular to breast cancer. And it is not necessary that they should go to a clinic for checkup. There are multiple avenues wherein the person can check by themselves. When it comes to age, say for example, as the age advances, it is better to go for early checkup. Say for example, if it is going to be men, then prostate cancer is possible at older age, so they should go for checkup and reviews depending upon the type of age that they are in. And if they have some comorbid conditions, and if they also get to experience these kind of signs and symptoms that I had mentioned, then it is always better to go and check. Yeah.
Okay, and one question about the kind of work you're doing, Dr. Aravind, in your lab. What are the future prospect of this treatment in the clinics? When it is likely to come for the actual treatment of the patients?
That depends upon a lot of factors. The thing is, right now, we do not have a proper validation methodologies. What we see is at lab level, we do testing with cancer cells in which are grown in lab. Then we go for small animal testing that you have seen like in mouse model. Now, when we switch from cancer cells to mouse model, the entire regimen and the concentration changes. The reason being, this is a kind of system, and that is a kind of different system. So when we go from mouse model to larger animal model like monkeys, again there is going to be a change. And when larger animal models to human clinical trials, again there are going to be difficulties. As a result of which, though we see excellent results in vivo models, we may not expect the same thing to happen when it goes for clinical trials. And when it comes to these kind of drugs, the clinical trials are divided into 4 stages, of which stage one or phase trial one will involve only toxicity testing. Just they will inject into the patient and they will check whether it is going to be harmful or not. And they will only proceed further if at all it is not harmful. Because the drugs on their own should not cause any harm to the patient. And then stage two, that is phase two, they check in a slightly smaller group of patients for therapeutic effect. And phase three, they check for a larger group of population. Once it is successful in phase three, then they start to introduce the drug to the market, which gets commercialized, and they observe the drug in the market for around 5 years or something. And if at all it is beginning to show some side effects to the patients who have taken up, then they may withdraw it or they may allow it to continue. So that is the way how clinical trials work. And because this is going to involve at least 3 phases of clinical trials, approximately it is going to take at least 10 years or 15 years, depending upon the number of patients who can be subjected to these clinical trials. So it is not a very fast pace project. Okay. And moreover, this is not an infectious condition wherein it is going to spread very fast. Okay, these are all going to happen a little slow, so we are fine with it. And every now and then there are new drugs that are getting approved, and even they are trying to have a drug which is going to be treated for one cancer. They are repurposing it and they are trying to use it for another type of cancer, in which case you need not follow these kind of stringent clinical trials, because already the drug is proven to be good for one type of cancer. So you do it with minimal clinical trials. In that way you can reduce down the number of years that are involved in commercialization. So as far as
Okay.
photothermal therapy is concerned,
Yeah.
the phase 1 clinical trial is over in the US. They have used silica gold nanoparticles, and they have successfully treated prostate cancer patient type, and it is now going to proceed to phase 2. So after phase 2, then it will have to cross phase 3 as well, and then it may come to market.
Okay, thank you for this information. We are hopeful that this comes to the clinics and for the final treatment of the patient. There's one question related to can non-smokers, they can have cancer?
Yeah. There is a possibility that it is not sure that all smokers are going to get cancer. There may be people who are smoking a lot, like 5 packets a day, and still they don't end up in cancer. At the same time, there are also people who do not smoke and they also do get cancer. Okay, one example I could give you is like Winston Churchill, the Prime Minister of yesterday's Prime Minister of UK. He was a chronic smoker, but then he never encountered cancer. And then there are also people who got cancer even being a teetotal, that is not smoking, not drinking. That completely depends upon the type of mutagens that are happening. Probably there could be some other reasons for it. And when it comes to smoking, it is not necessary that the person has to smoke to get cancer. Even passive smoking, even dwelling in an environment where there is a lot of smoke coming from industrial environment or from other people who are smoking, that also could affect the person. So that is why we call these as risk factors. We really do not know whether that is the exact cause, but then all these risk factors get accumulated and then they emerge as cancer. So yes, a person who is not able to, who's not smoking can also get cancer.
Thank you, Dr. Arvind. Lots of questions coming up. So I request the participants to mail their question at csi@jigyasa@gmail.com. I'll pass it to Dr. Arvind, and then individually he can reply because we
Sure.
are having shortage of time. So last question from your side, like as I remember, you were also medical doctor. I'm correct, right?
Yeah.
So there was one question in we conducted career in science for students. So what is your advice for the medical students who want to come into research? They want to become a scientist, the doctors, how they can do that?
So there are a lot of avenues. Gone are those days where there was very segregated procedures. Now there are a lot of institutes which are asking or which are welcoming doctors to apply for their programs and apply for the PhD programs, and they can always choose one. Only thing is that. If at all they want to do a PhD is more or less mandatory if at all they want to enter into science. And if at all they want to do PhD in their own branch like physiology or anatomy or biochemistry, then they have to do it in medical institutes. But then in our country, medical institutes are loaded with a lot of patients, so they are actually service centers, and apart from that they'll have to do research. So the amount of research that is happening in medical institutes because of the patient load that they have is minimal. And there are very good medical research that is happening in ICMR institutes. So and ICMR also gives special privileges to medical background students by giving them very good fellowships, so they can apply for those fellowships and also get their PhD done, and then they can choose their path. And if they want to enter into a new branch which involves technology as well, then they can do a kind of master's interdisciplinary program which will help them to bridge the gap, and then they can enter into it. And then when it comes to IITs, we have IIT Kharagpur, which runs an exclusive program for doctors. It is called as Masters in Medical Science and Technology, wherein only doctors are allowed to write entrance, and it's a 3-year program, and that will give them hands-on training or what are all the research methodologies that are involved in regular research. And then they get on to do their PhD as well if they want to continue, and they can get it. And even many other IITs are starting these medical research centers wherein doctors can apply.
Thank you, Dr. Aravind, for explaining it very clearly. And I thank you very much for your very nice talk and answering all the questions. And I also thank all the participants for being with us. So you can, as I told earlier, you can put up your question on our official mail ID. I'll pass it to Dr. Aravind, and I will request him to answer all those questions. So thank you so much for being with us. Next talk will be on 4th May related to art and art. Thank you.
Thanks a lot.